Good morning, I'm Mrs. Cavalier, and I want to thank the sophomores for showing an interest in this, the final assessment of the bioethics unit of the seniors class, Ethics of Public Policy. So we all live in a social contract, and when you are in a social contract, you have to commit to certain behaviors that are appropriate, and those behaviors are then legislated. In a democracy, we arrive by those policies through consensus or debate, because in an ever-growing world going into the 21st century and beyond, we are increasingly dealing with limited resources. Those resources can be tangible, like water or clean air, or they can be intangible, like education or healthcare. So today's debate is focused on healthcare. So the teams have been charged with a task to identify certain values in society that will support their opinion on healthcare, and then look for and provide to you credible resources to support their value statement. So your role is a very important one. Even if you are coming in today with an opinion about the rationing of healthcare, I'm asking you to set it aside. Your role is to, first of all, listen, record what you hear the team saying, and then vote for the team that you feel has the most compelling and logical argument on their side. You're then going to pass those forms to me or your teachers. I will keep them for a day or two, and then I will give them back to you. Your teachers may decide to ask you to write a reflection on what you've experienced today, and of course the seniors will be very anxious to receive your feedback. So with that said, I do want to mention to you that a Lincoln Douglas or value debate is timed. And so I am going to be holding up cards for the team so they know who is the next speaker, if they have 30 seconds left in their speaking time, and finally when to stop. Okay, so with that said, we're going to start with our first affirmative introduction.
Hi everyone. I'm here today with my team supporting the affirmative side of the argument that healthcare should be rationed by age. We believe that this is the correct way to deal with the rising cost of healthcare and increasing number of people who are uninsured in America. Healthcare, the prevention, treatment, and management of illness, and the promotion of mental and physical well-being through the services offered by the medical and allied health professions. In other words, the purpose of healthcare is to extend one's life. Should be. It is used to indicate obligation, duty, or correctness. Rationed. There is a fixed amount of commodity, in this case healthcare, allotted to each person during a time of shortage. Age. The length of time one has existed, the duration of life. The World Health Organization says that although there are many commonly used definitions of old age, there is no general agreement on the age at which a person becomes old. This use of a calendar age to mark the threshold of old age assumes equivalence with biological age, which is not necessarily true. This is why age should instead be defined more specifically as life expectancy. Healthcare is already being rationed, just not in an effective way. Instead of being random and unsystematic, healthcare needs to be prioritized, and using age makes the most sense. This way, the people who will benefit the most from healthcare can have access to it. Prioritizing healthcare in a structured way will save money and promote a better quality of life. Our argument also supports the values of progress and utilitarianism. Progress means the development or advancement of society. Utilitarianism means actions that promote the greatest amount of happiness to the greatest amount of people are entirely justified. Changing the way healthcare is rationed promote these two values by making the most out of the resources available to the people of America.
Ladies and gentlemen, as Americans, we can count on government to provide three things: life, liberty, and the pursuit of happiness. Rationing healthcare would violate these principles. The affirmative side proposes that we allow some people more rights than others. Today, the negative argues that healthcare should not be rationed by age. In any debate, the understanding of terms is necessary. The affirmative presents you with a technical definition of healthcare, the prevention, treatment, and management of illness. The negative defines healthcare as the preservation of human life. Both sides agree that the verb should indicates obligation, duty, or a matter of correctness. It is synonymous with must. In this context, rationing refers to doctors distributing medical resources among patients. The affirmative suggests that we discriminate against people with low life expectancies. They want to allocate more hospital funds and equipment to people with better prognoses to avoid unnecessary risks. The negative argues that age does not denote life expectancy in the majority of places outside of this debate. We believe hospitals will define age as a measure of time. A system that rations healthcare will favor the young over the elderly. This is an affront to John Locke's pursuit of happiness, life, and liberty. First, we argue that rationing healthcare limits a human's freedom to live out his last days in whatever way makes him happy. Doctors cannot accurately measure any man's potential. Second, we argue that life is sacred and must be protected. Based on the definition of healthcare, medical professionals should always work to preserve life. Rationing healthcare would go against this core principle. It is so counterintuitive that it reads like a dystopian novel. Many of you sitting here today have read The Giver by Lois Lowry. Take a moment to recall that the old and the sick infants of the community were euthanized. Since they did not serve a purpose in society, they were removed. There were no second chances and nobody defied expectations. We would not like our personal liberties to be taken away in such a manner. It is unethical and uncivilized to declare any person as unnecessary. Murder is illegal even if it is done within a hospital.
So we will both be speaking of the value progress. Progress refers to the development and advancement of society, both socially and economically. We're going to talk about the economic benefits that rationing healthcare based on age provides. Before we begin, it's important that you're all familiar with some statistics. According to a Santa Clara University study, currently about 12% of the population is 65 years or older. By the year 2030, that figure is expected to reach 21%. The fastest growing age group is the population aged 80 and over. They tend to require the most expensive and intensive medical care. This population is insured by Medicare, which pays by procedure. As of now, according to health economist Marilyn Moon, there are 47 million Medicare beneficiaries, costing $500 billion a year, or 1/5 of the nation's health spending. In 2050, the population on Medicare will number 89 million, raising the program's cost to close to $800 billion. In less than 10 years, if costs continue to rise, it's predicted that Medicare will go bankrupt.
If rationed, medical resources could be diverted from an elderly retired population to those younger members of society who are more likely to be working. As of now, the ratio of working people to retired people is 4 workers for every retiree, but this is expected to decline to only 2.5 workers for every retiree in the next couple of years. In addition, the National Institute on Aging reports that an estimated half of individuals that reach the age of 85 have or is developing Alzheimer's disease or another form of dementia, which limits their ability to contribute to society. In addition, as the cost of Medicare increases, so do working people's taxes, which pays for Medicare. The waning productivity of elders and the financial strain on working people is very detrimental to the progress of society.
Could I ask for the source of your statistic on people, or on the prediction of 2030?
Daniel Callahan from the Medical Care for the Elderly, Should Limits Be Set? It's a American Medical Association. It's a journal entry.
Okay, so you're saying that people 80 and over is the fastest growing age group?
Mm-hmm.
So does that mean more people are living 80 and over?
Yeah.
So if you want to limit healthcare to these people, doesn't that mean you are limiting access of healthcare to a growing number of people?
Well, Well, we're doing it's not healthcare as in we're not agreeing with your definition of healthcare. Our definition of healthcare is the extension of life. So we're not going to prolong life, we're just going to give.
Because we have this statistic, it was in an article in the New York Times, that 30% of the population who are the heaviest users of healthcare account for nearly 89% of health expenditures. And this population is the population that's 80 years older.
So you're saying you don't want to prolong life in people 80 and older?
Yeah, feudal care. We're not going to give unnecessary procedures, but we're still going to give the basic treatments and palliative care.
That way that the costs are able to be used more for the younger working population.
Do you have statistics on how much of that percent of healthcare is used for feudal care?
No.
66.8 billion a year goes to chronically ill patients in their last 2 years of life.
And how many billion were used on patients over 80 that are not in fetal conditions?
We don't have that information.
We will be talking about the values of utilitarianism and its relation to the quality of life. Utilitarianism is a theory that states that actions are justified if they produce the greatest amount of happiness to the greatest number of people. And it relates to the quality of life as a value standard that argues that actions are good to the extent that they enhance human satisfaction. The elderly are entitled to treatment to relieve pain and suffering, but by the age of 70 or 80, they have outlived their natural lifespan, and their death can only be delayed so long, and the wait is sometimes grim and degrading. You have to start looking at scientific evidence to say what has given us the most returns on our dollars, which is increasing the quality of life of someone. Think about the amount we are spending to prolong people's lives when the quality is no longer good. Medical futility means that the proposed treatment should not be performed because available data show that it will not improve the patient's medical condition. Patients are sometimes given advanced medical treatment that's not benefiting them. It's costing patients in terms of prolonged death and their families in terms of acting on inappropriate hope. About 68% of patients who have received futile treatment died in the hospital, and 16% died within 6 months of discharge. The survivors remain in severely poor health. In the end, the purpose of medicine is to improve the quality of life, not to lengthen it. A longer life does not translate into a better life.
A huge number of people die every year because they lack health care or their coverage is inadequate. Many people think healthcare rationing is like saying yes to one person and no to another. But we should be focusing on if people throughout America are getting the care they need. If the U.S. spent less on treatments for those who would die in a few months with or without treatment, it would be better able to save the lives of more people who could live decades longer with the right treatment. Society has other ethical responsibilities to its country, like personal and national security and education. Failing to ration health care would make the U.S. unable to meet these responsibilities and put a greater number of citizens at risk.
The survival rate for quadruple bypass or coronary artery disease is 50 to 60%, was 50 to 60% with life expectancy of 5 to 7 years. Now it's 80 to 90% with 15 to 20 years. The procedure is the same today, but we just have access to more patients who have undergone treatment successfully. How can we limit the treatment treatment to patients when our statistics on life expectancy keep being updated based on people being treated? I know that my grandfather would have lived to 20 years after his quadruple bypass in 1992 based on his life expectancy of 5 to 7 years after his treatment. How could we limit someone's access to health care based on life expectancy when we don't even know we can't predict exactly what the life expectancy of a person will be?
It's only one surgery. You can't base all of the U.S.'s healthcare on one procedure.
It's an example of procedure.
Can you think of more?